Now, as more Canadians get vaccinated, there is increased pressure to loosen restrictions. An expert advisory panel wants the federal government to scrap mandatory hotel stays for people returning to Canada. They also say other quarantine measures should be loosened for travelers depending on their vaccination status. Patty Hajdu is the Minister of Health. She's with us from Thunder Bay, Ontario. Minister, welcome back to the show.
Great to be here, David.
I want to start with AstraZeneca if I can, because Health Canada extended the best before date really just hours before they were set to expire. Why is that allowed, and do you expect people to have confidence in these particular doses?
Well, first of all, I'll just say that the regulators are independent. AstraZeneca applied to have these dose expiry dates extended by a month, and the regulators reviewed the data that was required to make that decision and made that decision, as you know, late Friday.
Do you have any concerns about people having confidence in it, given the AstraZeneca roller coaster that we've been on with this particular vaccine?
Well, I think Canadians can be really proud of the Health Canada regulators. They are considered gold standard regulators in the world. They are very, very thorough. As you know, they've been under a lot of scrutiny through this pandemic, for better or for worse. Some people think they're too slow. Some people now think they're too fast. But I'll just say this, they are fully independent, and they are extremely talented group of scientists and researchers that pore over the data that's provided by pharmaceutical companies, by manufacturers of medical devices, etc. And I have full confidence in the regulatory team to do the due diligence. They haven't hesitated to hold back, for example, product that doesn't meet their requirements.
Right, like the Johnson & Johnson doses, which are still being reviewed. So I want to switch, if I can, now to some of the quarantine measures, because right now people flying into the country have to pay to stay in a hotel for 3 days upon their return. But experts who are advising the government say, scrap that plan. Will you listen to their advice?
Well, certainly, first of all, really grateful that we have this expert panel of testing and screening that's provided this roadmap, if you will, for how we manage ongoing border measures that protect against the importation of COVID-19. The next step for me is to talk to my colleagues, the ministers of health across the country. As you know, although it is a primarily federal responsibility, provinces and territories have many opinions about how to manage the border, and it's important that I get a sense from them, their comfort level with the next steps. Dr. Tam has also said that measures should be alleviated slowly and cautiously, both domestically and internationally, because of course the virus continues to evolve and change, and we want to be sure that whatever we do does not pose additional risk to Canadians.
But you know, your government likes to say it's into evidence-based decision making, and you've got the evidence from the experts telling you the hotel quarantine isn't applied consistently, it's expensive, people are skipping it, and the 3-day quarantine isn't consistent with the incubation period of the virus. So if all of that evidence stacks up against it, what's the evidence for keeping it?
Well, when the measures were applied in February or so, it was really based on the new measure of testing at the border. If you recall, we were asking people to submit to an entry test. And of course, because they were PCR tests, only kind of tests that we can sequence with, it required a stay at a hotel until those tests were cleared as negative. And so that was the intent behind the 3-day stay, was really about trying to ensure that before the traveler went on to their next leg of travel, that we had that negative test, and that any positive tests could be dealt with properly to continue their isolation. Now that the panel is suggesting that that is not a necessary step of travel, I do want to confer with my colleagues, the health ministers, before we take the next steps. Obviously, I'll be interested in their perspectives. As you know, border management has been a hotly contended issue amongst provinces and territories, and I want to make sure that I understand the perspective of my colleagues before we take the next steps. The next order in council is set to renew on June 21st, so I'll be having that conversation with them hopefully next week.
Okay, because you mentioned it's a hotly contested issue, no more than here in Ontario, where Ontario Premier Doug Ford, he doesn't want it scrapped. He wants these measures expanded and extended to cover land borders. So how much is the political dynamic with Ontario a factor in all of this?
Well, again, I think it's important that health ministers and their teams have an opportunity to review this report and understand how it applies to their own jurisdiction. I think the next step, as I said, David, is it's very important I understand their perspectives. And so that conversation will be important. Dr. Tam will also be talking about the report with her colleagues at the Special Advisory Committee, which is all the public health officers from across the country. And I think, we've had a Team Canada approach up, till now. And I think it's important that we continue to go forward into the future with as much consensus as possible, knowing that there will be disagreements, of course, from time to time.
One of the other issues the panel is recommending is different quarantine and testing requirements, depending on if travelers have had 1 shots, 2 shots, no shots, been infected and recovered. Is this something the government will consider?
Well, absolutely. The whole report is, as I said, a very useful roadmap for what to do next on the border. And as we know, despite the fact that we're seeing only 5% of travel volume than we saw pre-pandemic, travel is continually increasing. And, people are hungry to see their family. They're hungry to travel for a variety of different reasons. And so this report gives us a very good roadmap about what the future could look like to manage any importation of virus as we start to see Canadians have better immunity through vaccination, and of course, hopefully the rest of the world have better immunity through vaccination. And that's really sort of the interplay, David. It's do we have enough protection here in Canada, and what's going on with the rest of the world? And it's a very, as you know, and as having covered this for the last 14 months or more, it's a very dynamic situation, and things can change so quickly. So we just want to be careful that whatever we impose and whatever we remove is actually going to add a net value to reducing our importation of virus and variants.
We are moving to that point, though, of reopening, and the expert panel says, a system to provide proof of vaccination should be implemented as soon as possible. So do you have a sense of what your timeline for this might be, and how quickly or how soon could you make that happen?
Well, we certainly have a head start with the ArriveCAN app, allowing for digital submission of documentation, for example. People should check it out, even if they're not travelers yet. This is an app that helps facilitate the uploading of documentation like test results and ideally vaccination results. So we've got a head start in terms of the ability and some of the technology necessary. The biggest challenge will be just around health data and the data that is considered private and held by provinces and territories. That isn't federal data. And so those are the questions that are being asked right now. How do we ensure that we have a system that allows that maintenance of privacy, but also can give the proper documentation that indicates that someone is vaccinated?
One final thing before we let you go. We're going to talk to the UK Prime Minister Boris Johnson later in the show. And as you know, he's hosting the G7 summit in England next month. Prime Minister Trudeau has said he's going to go to that, or we've been told by the UK government that Prime Minister Trudeau will be attending that in person. Doing this at a time when he's urging Canadians not to travel. He's only had 1 shot of AstraZeneca. I know he likes to talk about a 1-dose summer. Should he go to a 1-dose summit?
Well, I don't know what the preparations are for the Prime Minister's contingency. I know that, that meeting is held in a different location with maybe different parameters. I'll just say this, in terms of the G7, the health ministers meeting is next week, and I've made the decision not to go. It was a very hard decision, David, because, of course, there are opportunities in those face-to-face meetings to push forward on agendas like proof of vaccination, like what to do next on the border. But I felt that so many of my team have only had 1 dose, some have not had any vaccination, and yes, much of what could be accomplished we could accomplish virtually. So I personally have made the decision to stay back. I'm sure as the situation evolves over the next week, the Prime Minister will be taking into account the advice he's getting through his experts and the UK planners.
Should he go in person, do you think?
Well, I think there's always a value to meeting in person, and I think it's the balance of the perspective of what's happening with the epidemiology of the UK, the contingency that he's bringing, the plans for travel. These are all very important factors. I can't speak, as I said, to his planning and his team and what's happening with their preparations, but I can just say from my perspective, our team decided that at this particular time that we would continue for this meeting to meet virtually and look forward to the next meeting that presented itself.
Okay, Health Minister Patty Hajdu, thank you so much for your time.